This lecture is on alveoli, and it follows up on the lecture on the smallest branches of the bronchial tree and the bronchial tree in general. So, following on from the lecture on the bronchial tree, now the smallest branches of the bronchial tree end in bunches of tiny sacs that are called alveoli. And I'm just going to say here, as a way of thinking it, these look like bunches of grapes. That's just kind of a handy way of thinking about it. So, you're going to have the last bit of the bronchial tree, and then you can wind up with lots of little balloon-like sacs like that. And sometimes you will wind up having some balloon-like sacs along the way, and you will have things like this. But one way or another, you will wind up in the end with these tiny little fleshy balloons, basically, and these little flesh balloons, then, these are your alveoli, like so. So, the walls of the alveoli, then, are the respiratory surfaces. So this is actually the big ticket item. This is where gas exchange takes place. This is why you have all that tubing beforehand, is to deliver the air to the respiratory surfaces, which are the walls of the alveoli, those little flesh balloons, as I said. So why do we have all of that tubing? Why do we have all of that branching of the bronchial tree then? So the branching of the bronchial tree means that there is, once again, more surface area. For gas exchange. And the whole point behind all of this is gas exchange, getting oxygen for your tissues, giving off the CO2. And so basically you have all of these divisions and subdivisions of the bronchial tree so that you can get as much air as possible to those tiny individual sacs. If your lungs just had smooth walls and you had one big pipe coming in from the respiratory bronchi, from the primary bronchi, if you just had primary bronchi leading to big sacs, you would have much less surface area for gas exchange, and you really wouldn't have enough oxygen to run a body of your size. So, and this is why, when you look at the tissue itself, this is why the tissue of human lungs resembles a sponge. This can be a little bit surprising the first time that you look at lung tissue, really any mammalian lung tissue, is that you will see that, as I said, it's not just a simple sac on the inside, but rather all of these multiple tiny, tiny, tiny sacs, which means that the overall tissue of the lung, if you just take a slice out of a lung, it looks more spongy, sort of like a soft sponge, than anything else. So the subdividing increases the surface area, of course. And an important thing here is that the passage then of gases, which is, after all, why we have a respiratory system. The passage of gases from air to body, our ability to take up oxygen and give off CO2, then, is aided by chemicals called surfactants. And this is important. Basically, without the surfactants, we would not be able to breathe. We would not be able to inflate our lungs. So the surfactants then are chemicals inside the lungs and what they do is they reduce and equalize surface tension. This may be hard to think about, but this is what's going on then among the alveoli, and this allows the lungs to inflate at all and do it evenly so that all the alveoli inflate to the same degree. So what's going on is this. This can be a little bit hard to understand, but what's going on is with surface tension, you can think about surface tension. Water has surface tension, and your bodies are made out of water, and all of those little alveoli then have a lot of water making up their tissue as a part of their tissue. And then water, as I said, has its own surface tension, which can therefore make it harder to inflate that little alveolus. What I mean is this. Think about blowing up a balloon. When you start blowing up a balloon, it's really hard. And that is because the surface tension of that rubber or plastic is fighting back against your trying to inflate it. So you really have to work really hard to overcome the tension in that store-bought balloon. you've probably noticed that once you get it going, it becomes much easier to inflate. And this is the way that surface tension works, is that it's hard to overcome when you're trying to inflate something, but once you start inflating, the surface tension goes down and down and down the more you inflate it, which is why it can be awfully easy to pop one of those little balloons that you're blowing up if you're not paying close attention. The same thing is true in the alveoli in our lungs. There's surface tension there. And that is why when we start inflating our lungs, it's actually a little bit harder than as things go along. And imagine now not just trying to inflate one little supermarket balloon, but trying to inflate dozens while all blowing through one mouthpiece, through one straw. It would be nearly impossible to blow up all those balloons at once, to overcome that amount of surface tension at once. And that's the job that you're giving your respiratory system, is to inflate all of those alveoli at once. It's actually impossible to do without the help of the surfactants. What the surfactants do in the first case is reduce the surface tension so you can inflate your lungs at all. And then, because some of the alveoli might get inflated a little sooner than others, the surfactants also equalize the surface tension among your alveoli so that you don't wind up superinflating and even popping some of your alveoli while the other alveoli remain completely uninflated. So that's what's going on here. That's what surfactants do. First of all, they reduce the surface tension in your alveoli so you can inflate your lungs at all. And second, they also equalize the surface tension among your alveoli so that all of your alveoli inflate to the same degree. And we could not live without surfactants. We actually could not breathe without surfactants. And this can lead to a problem for premature babies. So just as a quick aside here, premature babies lack surfactants. One of the deceptive things about human development, about prenatal development in general, is that things happen at different times, and sometimes biochemical systems are the things that develop late. And that's what happens in the case of our surfactants. That ability to produce surfactants happens late in development, which leads to the tragedy that a premature baby can look perfect because the lungs are there and the tissues are there, but they are not yet producing surfactants, so the lungs cannot inflate. These days, we actually have surfactants that we can treat premature babies with so that they can breathe and keep developing long enough to develop the ability to make surfactants themselves. So these days, as I said, we can keep those babies alive, but that is one of the dangers to premature babies, is that they have not yet started producing surfactants, and as a result, they can't inflate their lungs by themselves. So we have to give them the surfactants in order to allow them to do that. And that ends our lecture on alveoli.